Hi, it's Lucy Whiteman, the Director of Public Health, and I wanted to come and talk to you about COVID in Essex at the moment. So I'm sure people are aware that case rates are going back up. Now, that is a kind of a natural and expected phenomenon, and we'll continue to see this now for quite some time. We've got small variations in the different strains that come through, and at the moment our dominant strains are subvariants of Omicron, and they are slightly more contagious, and so we're seeing case rates go up a little. What I would say is that obviously we still need to be looking out for each other despite the fact that all of the restrictions have been formally removed. And I would really implore people who do become symptomatic of COVID or with COVID to obviously avoid going into enclosed spaces, particularly socialising with people who are vulnerable, and if possible, obviously work from home too. Now, interestingly, the symptoms for this more recent strain are more around a sore throat, a sort of a loss of voice and a gravelly sore throat, headaches, and you still do sadly get that fever and other symptoms that are more traditional, like the cough, for example. So if you've got any suspicion, then obviously please do access testing if you're able to purchase them. Some people are still obviously eligible for free tests, but that primarily is frontline workers now. But obviously if you are able to test, that's great. But if not, please just err on the side of caution. And as I said, avoid work if possible, avoid enclosed spaces, and certainly avoid becoming in contact with people who are vulnerable. Now, the good news is, though, that the vaccination programme continues to be rolled out, and that is an evergreen offer, which means that even if you haven't had your first vaccination, you are still very, very welcome to go and attend any of our vaccination centres and start that programme. The government have also just recently announced that there will be an autumn booster programme, and at the moment the people that they're including are going to be that extended group who usually have flu, so adults aged 50 and over. We're looking at secondary school age children in years 7, 8 and 9 for flu, and then specifically COVID is going to be again adults aged 50 and over, those aged 5 to 49 in clinical risk groups and or who are in the household of those clinical risk groups or people who are immunosuppressed. Any carers aged 16 to 49, as usual residents in care homes and care settings, and frontline health and social care workers. So you will get notified if you're in one of those groups that you're eligible for your flu and your vaccine, your COVID vaccine booster. So you will obviously be notified and called in. If you've got any queries, then obviously you can still utilise all of the government information sources, or indeed contact your GP nearer to the flu season, which usually starts around October. As I said, people can actually purchase tests if they do have any concerns, but as we know, testing is now reduced. So our stats, etc., are based on the Office of National Statistics primarily. They do a sample size of people and see if they are COVID positive. Now, do remember you can have it without symptoms as well. So we've probably got a slight underestimate of the rates, but we have, as I said, been seeing that going up, particularly in working age adult groups. So the other thing is to note, we have seen a slight increase in hospital admissions. That's quite a good measure, obviously, because people are routinely tested still as they enter that care setting. The interesting thing is, although case rates are going up in hospitals, quite often people are presenting with a different complaint, and then they're found when they're screened to have COVID, so quite often have very low or no symptoms at all. So it means people aren't terribly unwell with it, but it does mean it's certainly still circulating in our communities. So all of those common sense approaches that we used before still apply. If you do know somebody who's immunosuppressed or vulnerable, then obviously making sure that you take precautions when you visit. Face coverings are still obviously routinely available to purchase, etc. Lots of people have still got stock if you are interested in getting hold of that through healthcare settings. But obviously it is still sensible if you're working or visiting people who are particularly vulnerable. And obviously all of the hand washing and normal hygiene benefits for any kind of respiratory or infectious disease continue to be routinely recommended. But otherwise, at the moment, we're just trying to enjoy the summer. As I said, it's quite frequent that you will see dips and rises in an infectious disease pattern of community transmission. So please don't be shocked by that, and should obviously case rates get to a point where either there's concerns about how effective the vaccine is, or there's a mutation that means that, you know, for example, we're seeing different symptoms and or affecting different population groups, or indeed if our hospital or NHS services get overwhelmed to the point where they cannot cope at all, then we may see obviously different messages coming out. But at the moment it's, you know, keep going, keep being sensible, keep looking after each other, and obviously take care of yourselves too.